What can those things be? Well, first, let's talk about how diabetes can hurt you. Diabetes, with the increased circulating insulin, as well as increased circulating glucose, causes damage to the lining of the blood vessels, much like what we talked about with respect to hypertension. That endothelial lining within the blood vessels is very critical for normal delivery of blood and nutrients to the organs and the cells of your body. When you get damage to those endothelial cells, you lose the efficient delivery of those nutrients and oxygen to the various tissues and organs in your body. And as a result, you start having loss of those organ tissues and cells, leading to ultimate organ damage. It can happen at the level of your kidneys. It can happen at the level of the nerve cells in your body. It can happen at the level of your heart, your brain, your lungs. Every organ and every tissue in your body is susceptible to being damaged as a result of poorly treated, poorly diagnosed, and poorly controlled diabetes. Diabetes is a multi-organ issue. And if you don't take care of it, trust me, over time, it will definitely take care of you. And it does so very slowly and insidiously. A lot of people initially don't notice that they feel badly with diabetes, particularly if they've not got extremely high glucose levels. And so they feel like it's not that big of a deal to have to take this medicine every day or follow this strict diet or continue to do regular daily exercise. But over a period of years, and many times over decades, that slow degradation of those tissues and organs leads to loss of renal function, loss of kidney function, resulting in renal failure, putting you in a position where you're going to be hooked up to a dialysis machine to sustain your life. It causes damage to the nerve endings in your extremities, whether it be your feet or your hands, which in many cases put you at risk for injuries that you're not detecting, can lead to infections and ultimately amputations. Amputations of toes, amputations of feet, amputations of legs, amputations of fingers. It can cause sudden blindness as a result of what we call diabetic retinopathy, where you get damage to the blood vessels in the back of your eye. And so over years, you can end up missing limbs, hooked up to a dialysis machine, blind, having had a heart attack and or a stroke. And after all of those things have happened, after you've been completely debilitated, it's only then that diabetes generally will kill you as a result of some overwhelming infection. And that can happen over, again, a year of time of decades of continuous damage to the blood vessels and organs associated with those blood vessels. So I can't express to you more vigorously how important it is that if you're at high risk, that you get diagnosed and you get treated, both with respect to your own behavioral modification as well as in coordination with your healthcare provider, to be sure that if it is that you are one of those people who have developed this disease, that you take really good care of it. Because like I said before, if you don't take care of it, I promise you, over time it will take care of you. And it's something that can be totally prevented. One of the questions that I got when I was asked to introduce this video is, if you're already diabetic and you're checking your finger stick blood sugars, what do those numbers mean? I mean, what are your goals in terms of glucose control using finger stick monitoring? Well, it depends on whether you're checking your sugar first thing in the morning before you eat. Your fasting blood sugar, if you are already diabetic and on treatment, should be between 80 and 110 milligrams per deciliter. That would be ideal. Postprandially, meaning that you test it after you eat, you should wait at least 2 hours after taking in a meal, and then it shouldn't be over 160 milligrams per deciliter during the daytime. Those should be your finger stick goals. If you're on insulin and you're also already on a continuous glucose monitor, one of those monitors that you have stuck onto your arm that you can get the continuous readings of your sugar on your phone, or on a reader that you can also get with the sensors, then again, you have a much better opportunity to be able to see exactly what activities, whether it's the type of foods that you're eating, the type of exercise you're doing, whether you're getting adequate sleep at night, which if you're not, that can also increase your sugar levels. Stress levels can increase your sugar levels, whether you're in a stressful environment at work or having a stressful environment at home. Those things lead to increased production of cortisol from your adrenal glands, which increases your glucose levels and can make your diabetes more difficult to manage. All of those things can be monitored using a CGM and lead you to making some behavioral and lifestyle modifications that can help make your glucose control much simpler. Every 3 months, you should be going to see your physician, at which point they should be drawing a hemoglobin A1C test, which gives us an idea of what percentage of your red blood cells now have glucose molecules attached to them. The higher that hemoglobin A1C, the greater the risk is that you'll develop microvascular disease, leading to organ disease later on in the progression. The goal when you're on treatment is for that hemoglobin A1C to be less than 7% if you're less than 70 years old. Between 70 and 80, we allow that A1C to go up a little bit to about 7.5%. And over the age of 80, an A1C of less than 8% is considered at goal. Why is that? Well, the older you get, the greater your risk is of problems if we control your glucose too tightly and you end up with a low blood sugar. Low blood sugar in an elderly patient has a very high risk of heart attack associated with it. So we try to keep that sugar a little bit higher in our elderly populations.